Now I'm pleased to introduce the closing keynote session, Unpacking the Intersectionality of Childhood Disability and Racial Identity or Ethnicity in Canada, with Drs. Evdokia Anagnostou and Dr. Delorence Lamptey. You can find their full bios on our events page on the website, but briefly, Dr. Evdokia is a child neurologist and professor of pediatrics at the University of Toronto and the vice president of Holland Bloorview's Research Institute. She also holds a Canada Research Chair in Translational Therapeutics in Autism Spectrum Disorder and the Dr. Stuart D. Sims Chair in Autism at Holland Bloorview. Dr. Lamptey is the inaugural EMBARC, or Empowering Black Academics, Researchers, and Knowledge Creators, scientist. He's an EMBARC scientist at the Bloorview Research Institute at Holland Bloorview Kids Rehabilitation Hospital. And he was one of the inaugural recipients of the Provost's Postdoctoral Fellowship for Black and Indigenous Scholars at York University. He's a Black scholar with a visible disability. And now I pass the mic over to you, Evdokia.
Thank you very much. It's such a pleasure to be here. Thank you for the invitation. I won't take a lot of time. I will pass the mic very soon to Dr. Lamptey. I'm going to wait for him to share the slides. But as he's doing that, thank you for such a rich conversation today. And hopefully in accordance to the themes that have been brought up, allow me a very quick positionality statement. So as mentioned, I am a physician and I am VP of Research at Holland Bloorview at University of Toronto. I'm a woman, I'm a cis woman, I'm a recent immigrant to Canada, and I bring such perspectives to how I think about disability and equity in the kids and youth world. So with that, if I can have the next slide, I will attempt a land acknowledgement. I know that there are discussions around land acknowledgement and what they serve, but if you allow me my interpretation as a new immigrant to the country and as a researcher, I'll take a couple of minutes. So I'm joining you from Holland Bloorview at the University of Toronto. So I acknowledge the sacred land that I am sitting on today, which is the territory of the Huron-Wendat First Nation, the Seneca, and most recently the Mississaugas of the Credit. The institution, and I personally recognize Indigenous land title as set forward in 1763, which actually envisioned self-determination and self-government. And we've had discussions, I've heard you have discussions today about how one can think about self-determination and self-government when it comes to research and research data and research participation. Within Holland Bloorview, we continue to work to understand the implications of the Truth and Reconciliation Report in the ways we are organized and we are governed and how we make decisions. And in particular, we work with our Indigenous partners to think about how we act on the knowledge of the trauma and harm that was caused to Indigenous peoples by research and research communities like ours for a long time. We are committed to learn with our Indigenous partners based on partnership and respect for the many ways that there are to learn and know and be. And we are learning ways of learning from our Indigenous partners. We are grateful and honored and humbled to have the opportunity, and I personally am, as a new immigrant, grateful, honored, and humbled to have the opportunity to live and work in this city and this territory that we call Turtle Island with our Indigenous partners. So, Shimi Whites, merci, thank you. And I appreciate the time to do this. I would like to move to the next slide quickly to introduce to you the agenda and the program that I would like to introduce before Dr. Lamptey takes over. I will introduce you the EMBARC program, which is a program that was set forward by Holland Bloorview a couple of years back to address specifically the barriers that Black scholars face in order to develop successful academic careers. We have made a lot of gains at getting promising Black scholars through their graduate programs. Lots of room to still improve, but we have made gains in getting them through graduate programs and postdoctoral fellowships, but we are still very behind in helping them make the transition from doing science work under supervision to being independent scientists and have independent careers. So to facilitate and to break some of the barriers and facilitate bringing more Black scientists into the disability research space, we launched the Embark program that you heard about. It is focused on addressing the gap from the lack of the Black voices in research. And we consider that gap really important because for a variety of reasons. One is the lack of Black mentors for Black students, graduate students and postdoc, and people that will put forward graduate students and postdocs for academic positions. The lack of diversity of perspectives in disability research, especially in pediatrics, and thinking through the intersectionality between disability and race when we think about pediatric health outcomes. And lastly, we have heard from our partners, the kids and the youth that we have engaged extensively with, the lack of representation of Black academics in research and research teams is actually really salient to Black children and youth who come as participants into the studies, as they do not see role models of who they can become as they grow up and what kinds of impacts they can have. So the program was co-launched with University of Toronto and the Black Research Network. It's a practical, pragmatic program to deal with some of these issues. It includes startup funds for research, principal investigator status for Black academics, access to advisors from diverse backgrounds, connections to networks for career and support, and media profiling to develop the personal brand of a Black scientist. So if Dr. Lamptey can get to the next slide, I will do a quick introduction of him, who's our first Embark scientist in the program. Dr. Lawrence Lamptey is a Black academic scientist who also identifies as having a disability, and he will talk to you about intersectionality of race and disability, of which he has lived experience of. He is a psychologist from Ghana with a PhD in rehabilitation science from Queen's University. He has done extensive work, postdoctoral work after his doctoral work across Canada, across University of Toronto, Mount St. Vincent University, and York University in a variety of areas that touch pediatric disability, race, and their intersectionality. Is well published, both with traditional academic outputs, but also has done work on policy and services for kids and youth with disabilities. So with that, it is my honor to introduce him, and I will pass the podium to him. Thank you.
Thank you so much, Evdokia. And thank you so much, everyone, for having me on this conference. Yeah. I'm excited to present about some of the work that we've been doing here at Holland Bloorview through the Embark programs. Yeah. So I'd like to talk about the intersectionality of childhood disability and race across Canada. And I'm going to use a national survey called the Canada Health Survey on Children and Youth to demonstrate some of these intersectionalities and some of the findings, and then some of the issues that have been coming up based on the research that we've been doing here so far. Yeah, so as I said earlier on, the whole Embark program is looking at exploring the intersectionality of childhood disability and racial identity on the experiences of children across Canada. And some of the experiences we are looking at include physical, mental health, employment, nutrition, education, and community participation. And this study involves like a large Canada-wide population representative survey. So one of the studies that we've been looking at it has to do with food insecurity across Canada. And the purpose of it was to look to examine the extent to which the intersection of race and disability actually determines food insecurity levels among children and youth in Canada. And the outcome measures within the survey, we use the Household Food Insecurity Survey model developed by the US Department of Agriculture, which has been found to be a valid tool for assessing food insecurity here in Canada. The Canadian way of measuring food insecurity using this tool has got a number of categories, including food secure, marginally food insecure, and then moderately food insecure, and then severely food insecure. Now, in terms of the analysis, I included what we called bootstraps in order to make the analysis, the findings applicable to the Canadian populations. So in terms of the socio-demographic characteristics of the participants within the survey, we have about 42,000 caregivers of children and youth across Canada, across the provinces and territories of Canada. And then 11% of these caregivers reported that their children had some type of disability. And then 6% of the caregivers identified their children as Indigenous. And then we have 26% identified their children as visible minority, including Black, Chinese, Southeast Asians, and so on and so forth. In terms of the preliminary findings, we realized that children with disabilities have about the prevalence of food insecurity among children with disabilities is about like it's almost 30%, like in Canada, compared to almost 15% for children without disabilities. Meanwhile, the overall food insecurity, like across the country, it's slightly above like 15%. So from the word go, we kind of realized that like disability has some kind of like a strong association between food insecurity. But to test this further, we conducted a series of regressions, multinomial regressions, to be able to get into the associations. And then we had the main effects, and then we had the interaction effects. With the main effect, we realized that children with disabilities were like over 3 times more likely to have severe food insecurity compared to those without food insecurity. And then Indigenous children were also over like 2 times more likely to have severe food insecurity compared to like non-Indigenous children. And then we've got the South Asians and then the Chinese, who were actually better protected from food insecurity compared to not a visible minority children. So I would want to pause here and then explain a little bit of some of the terms that I used here. So I choose to use the term not a visible minority because I realized when I went into the data, like I went in with a layman's perspective, knowing that like not a visible minority actually was like referred to white. But when I checked the definitions of not a visible minority based on how the government of Canada like defines it, I realized that it included a lot more people than just white people, including Indigenous people. So indigenous people are also classified in this definition of not a visible minority people, and then also classifying people as indigenous versus not indigenous would also include people like me who was originally from Ghana, but I'm not indigenous. So it made it kind of very difficult to actually like do a three-way interaction analysis to combine indigenous and then not a visible indigenous versus disabilities to look at what the results would look like. So what we did was we decided to do the analysis, separate analysis, interaction analysis for indigenous populations, and then separate interaction analysis for visible minority status. So in terms of our interaction analysis, we realized that for indigenous children with disabilities, the relative risk ratio actually like exceeds 10 times more likely. So in the previous slides, indigenous children, regardless of whether they had disability or not, had slightly slightly over 2 times more likely to have severe food insecurity compared to those that were not indigenous. But when we combine that with disability, we realized that indigenous children with disabilities were more than 10 times likely to have experienced severe food insecurity compared to non-indigenous children without disabilities. And the data also shows that non-indigenous children without disabilities, non-indigenous children with disabilities also have severe food insecurity. And then indigenous children with disabilities also face severe food insecurity. And so one of the key findings is that indigenous children, although indigenous children without disabilities and then indigenous children with disabilities both face food insecurity, those with disabilities actually face the highest form of severe food insecurity across the country as of 2019. With regards to food insecurity versus visible minority status and then disability status, we realized that those who identified as not a visible minority who has got disability also had significantly high levels of severe food insecurity. And the highest in this group were Black children with disabilities. They had over 4 times more likely to face severe food insecurity in Canada compared to not a visible minority children without disabilities. Yeah, and one of the things that we realized was that even for groups that the main effects showed that they were protected against food insecurity, when we combine that, including South Chinese children without disabilities, but we realized that when we combine that with disabilities, actually Chinese children with disabilities are not protected at all against food insecurity. And so it highlights the importance of these kind of intersectional, doing these intersectional analysis, because we would have actually missed out on these key difference if we hadn't done this, if we had just looked at the main effect results without looking at the intersectional effects. So in summary, we for this particular study, we realized that childhood disability and racial identity or ethnicity on its own are insufficient to provide a comprehensive understanding of childhood food insecurity in the country. And the intersectionality of childhood disability and race is an important determinant of household food insecurity in Canada. Indigenous children with disabilities actually face the highest risks of severe food insecurity in Canada, and Black children with disabilities face the second highest risk of severe food insecurity in Canada, followed by non-Indigenous children and then other Asians, including Filipinos, and not a visible minority children with disabilities, and then Indigenous children without disabilities accordingly. The next...
Okay, the relation.
Hello?
I think we're picking up some background noise from someone's not muted computer. I think we're okay now.
Okay, all right, okay. Thank you. Yeah, so the next study I would like to share about from this project is looking at the caregivers' perception of the health of their children. And this also follows the same approach, looking at like how the intersection of race and ethnicity, and then childhood disability would actually impact how caregivers perceive their children's health. And this is subjective health that was measured in the survey as excellent, very good, and then good, fair, and poor. So in terms of the findings, the main effect actually tells us that like disability is a very huge factor in determining how caregivers perceive their children's health. And in particular, caregivers with children with disabilities were more like over nearly 60 times more likely to rate their children's health as poor compared to those without disability. And even though some of the races also matter, like because of the huge figures for 55, it kind of reduces some of the relative risk figures for the other race, but some of the race also had like significant, but they were not as significant as compared to the main effect of disability. Now, in terms of the interaction effects, we realized that caregivers of Indigenous children with disabilities also were over 70 times more likely to rate their children's health as poor compared to those without disability. And then for non-Indigenous children without disabilities, their caregivers were more likely to rate their perceive their health as poor by over 50 times more. For the visible minority group status, we also realized that like for those without disabilities, like the relative risk of rating their subjective healthcare was very minimal. But when we combine that with disability, it also changes the dynamic. And then we realize that like for Black children with disabilities, they are nearly about 140 times more likely to rate their their children's health as poor compared to not a visible minority without disability. And then you also have the not a visible minority children with disabilities also having very poor ratings from their children, from their caregivers regarding their healthcare. So in summary, like these are just two of the mini studies that we are pulling out from this big data sets. So for this, the study on caregivers' perception on healthcare, we realized that like there is a variation between according to disability status and racial identity. And then we also realized that although children with disability significantly increase the childhood disability, this significantly increased the likelihood that caregivers would perceive their children's health as poor. The extent to which caregivers would perceive their children's health as poor was significantly exacerbated for many visible minorities and indigenous children with disabilities. So caregivers of Black children, as we saw from the graph, had the highest likelihood of perceiving their children's health as poor in Canada. And then Chinese children with disabilities had the second highest, and then followed by other Asians and then indigenous children with disabilities accordingly. Now we realize some general limitations within the data sets, which I would like to kind of discuss into further details. So the data sets excludes children living in foster homes, institutionalized settings, and then and on First Nations reserves and other indigenous settlements like in Canada. And even though the data set kind of provides us some useful data, I feel that by ignoring this population has is one of the as this group of children are more likely to also face inequities within the systems by the virtue of the fact that in foster homes, in socialized settings, and then they also lived on reserves. And then the conceptualization of disability too was also not very straightforward. So for some disabilities like autism, like learning disabilities, it was very clear that they were included in the data sets. But for most of the other disabilities, it was based on functional limitations. So the extent to which the child could functioning, including seeing with glasses, or your child is able to walk with or without a mobility assistive device. So it makes it very difficult. So even though we could use the level of functioning to determine, have some kind of knowledge about who is likely to have disability or not, it also kind of makes it it's limiting in the sense that we are not able to kind of identify specific disabilities to be able to study them and then know exactly what their needs are, and to inform better policies and programs to better support specific children with specific disabilities. And then the way race and racial identity and ethnicity was conceptualized was also problematic. I talked a little bit about that earlier on in my presentation. So when we consider indigenous versus not indigenous, it does not also take account mixed identities. That is, you could be Black and also be indigenous, based on your cultural heritage. And so the data sets do not allow us to kind of pick up on these pick up on these differences, and especially when the data, like the same data set is telling us that if you were Black, you are more likely to have severe food insecurity, and then if you were indigenous. So I would like to see, well, if you were Black and then indigenous and you had disability, like what would it like? How would your food insecurity level look like, or how would your parents perceive your health? But currently, the data doesn't really allow us to do that. And then the definition of not a visible minority is also a little bit like challenging, because it also includes like white only people. We also have white and Latin America. So if you had two parents from Latin America, you were considered a visible minority. But as soon as you have one parent white and then the other Latin American, you were not considered as a visible minority. And similar to white and then Arab, you have whites and West Asians like only. So this definition also makes it very difficult to actually have a comparison between, for example, white only versus Black, and it's kind of masks a lot of the experiences that people may be experiencing underneath. And as I said, the government definition of not a visible minority also includes indigenous populations too. And another challenge that we faced during this research was the relative small sample size of indigenous and the various groups of visible minority children with disabilities. So, for example, with the food insecurity study, we have about like nearly 4,500 of the sample were non-indigenous children with disabilities, compared to 400 indigenous children with disabilities. And then we also had about 3,900 of the sample who identified as not a visible minority with disabilities, versus just 160 children, Black children with disabilities within the data sets. And breaking these smaller samples further down by the response choices. So when we look at the food insecurity, after the 160 Black children, like some would choose food secure, some would choose marginally food insecure, some will also choose moderately food insecure, and then severe food insecure. So the sample size for each category would like further reduce. And what this means for the analysis is that like the precisions of the quality of the precisions of the estimates would also be limited. And then it also kind of limits the types of analytical approaches that we could use to analyze the data to actually make it more robust. So in terms of some of the recommendations to actually address some of the limitations that we find in the data, from my experience, I think that we should always not assume the definitions that we see in secondary data sets that we'll be working with, especially if we didn't collect the data. And we would have to make the effort to find the source of the definitions, because some of these definitions may not be included in the code books that will be associated with the micro data. Yeah. And if you're able to do this, this would also help in the accurate interpretations of the results based on the how the terms were operationalized in the data sets. And another recommendations would be improving data collection procedures and strategies of national surveys to support better data disaggregation. So, for example, better operational definitions to support the exploration of the unique differences of various visible minority groups. And I feel that the question I asked, we ask ourselves at Holland Bloorview here is, I mean, who gets to be included in terms of defining or creating these definitions, saying that, well, this is how visible minorities would be defined in government data sets, or this is how disability would be perceived in government data sets. And we feel that if the decisions are more inclusive, including like the key people that really matters to them, then it's what kind of improve upon the data sets to be able to kind of look at how we can actually disaggregate some of these data to look at specific issues that are bothering specific populations that are likely to experience marginalization. And then we also would have to address some of the barriers that prevent racialized or ethnically diverse children with disabilities in their families from participating in research or providing adequate information on their lived experience and then needs when it comes to participating in research. From my perspective, upon talking to some families, sometimes especially with since, for example, disability is also like linked with your immigration status. So when you're a new immigrant coming here as an international student, and then they are trying to work towards permanent residence or work towards citizenship, some of the screening criteria is looking at like to what extent do you have like disability, and sometimes they are afraid that, well, if they disclose that they had disability, it's going to actually lower their chances of getting approved for a permanent residence or like their stay in Canada. So sometimes it also creates like distrust in the system, or like it creates a barrier in the system where even though people are maybe participating in research, they are not willing to actually declare they are not willing to give us tell us whether they have disability or not, because of the fear that it might impact their immigration like status in this country. And another recommendation that we have was we need to have ethical considerations and then creative management of data analysis techniques that would highlight and account for disconnections and tensions that may exist between the results that would emerge from the data and then the actual lived experience and needs of diverse populations. And then addressing the implications of these tensions in a manner that promotes the priorities and the interest of diverse populations beyond the research life cycle into the future. So there are times where you use the same data set that will tell you, oh, well, indigenous children with disabilities have severe food insecurity. And then the same, which would confirm a lot of the research that we know, and also the lived experience of many indigenous people. And then the same data sets would also tell us that, well, indigenous children, for example, may be doing like better on some variable that may not necessarily reflect their lived experience. And in doing this, we need to be able to navigate and look at, well, how best do we report the data in a way that does not actually compromise or do damage to the indigenous populations or visible minorities. So we need to be able to come up with creative ways of data management and then analysis technique. And then we also have to highlight and discuss these tensions in a manner that do not cause damage and also promotes the priorities and interest of diverse populations that we want to serve. Yeah. So this brings me to the end of my talk. And at this point, I'm going to stop here.
Thank you so much, both you and Evdokia, for a wonderful presentation. You speak passionately about your work and suggested some very practical, albeit probably complex, ways of improving the research process and elements of it to ensure greater equity as we move forward. My key takeaways from the day, intersectionality is the theme of the day, it would seem. The importance of considering intersectionalities in research, team composition, research design, data collection and analysis. And your session certainly spoke to that. Now let me get some questions ready. Here we go. Lee asks, I'm curious about whether you think the high burden of care for parents of children with disabilities impacts their ability to work, which then would influence food insecurity. Do you think there's a employment intersection there as well?
Yeah. So research from Canada, like that's a little bit old, like shows that caregivers with disabilities are less likely to work, and then also less likely to like full-time, and then sometimes they work part-time, and then they're also less likely to also even like take on like promotional roles at their workplace, just because to make enough time for their children. And disability is also associated with a lot of like financial costs. So compared to like people without disabilities, so people with disabilities will spend like more in assistive devices and other like even with adaptive cars and equipment compared to those without like disabilities. So this also will also impact upon their financial like status, and that would also link to the like their likelihood of experiencing high food insecurity.
Yes, no doubt. And probably many other factors like housing issues and other social determinants of health. They're all sort of intersecting all the way through. So Jacqueline comments, it's a very interesting study and consistent with some of her own clinical experiences. She said she may have missed it, but was disability defined to also include mental health related issues?
Yeah, so disability is actually defined to include mental health issues. So the way that the survey defines disability, they use the child and youth functioning model designed by the UNICEF, and then and then the World Bank group of company to kind of measure functioning and disability in children. And one of the things I was in a meeting with some of the designers of the survey, and I asked the question why they didn't actually include specific disabilities. And they never really gave me like an answer. They said, well, I mean, they wanted to speak about like functioning of children more than like specific disabilities. But then the question I also asked in this follow-up was, well, so why do you include disabilities like autism or learning disabilities? Because they are also like disabilities, and why don't you speak about the functioning? So these are like things, and I think that there's good, like if we had a better way of conceptualizing these type of definitions, it would help.
And do you know of work, you or Evdokia know of work happening to sort of identify what a minimum set of questions might be, or a minimum data set that one would collect around some of these issues in intersectionality?
Lawrence, you can go first, and then I can speak to other perspectives.
Yeah, so in terms of sometimes like we need to gather, like people have got like different aspects of their lives, like intersection. So in terms of like sexual orientation, like I didn't include sexual orientation in my analysis because like there were very few like amount of like people who did not identify as male like or gender, like there are very few. So in terms of trying to look at uh one disability issues and then also like proper definition of terms so that like when we talk about disability, we know what you mean. When you talk about like sexual orientation, we know like what you mean, and not just that, but like cultural appropriateness of like what you say like would also be very helpful. Yeah.
Yeah. So to Lorenzo's point, it depends what the work is about, right?
Yeah,
so
fair.
when you're using national surveys, you're kind of limited with definitions that have been already employed. We may agree, we may disagree. We often disagree. The truth is, in terms of how the different conditions get incorporated in definitions of disability. There are two schools of thought in general. So there is a school of thought that thinks transdiagnostically in terms of disability. And in those cases, we think about impairment, functioning, goodness of fit, both communities we build and the characteristics of the person matter in those kinds of definitions. And then in healthcare systems, traditionally, we also think about the condition itself what Lawrence made the point. So we would make a functional assessment, but we would also think about autism distinctly from cerebral palsy, distinctly from somebody who has a spinal cord injury. We think both are very important, right? Because they come with different types of intersectionalities attached to them. And so we have strong feelings and happy to collaborate about developing new ways of conceptualizing how intersectionality should be captured in the space of disability in children and youth. But we also recognize that there is value to the very large data sets that are available by the Government of Canada with all the limitations of how definitions have been made, and also the limitations of how data has been collected and who's represented and who's not, to actually get kind of a first readout of how those two interact and impact long-term outcomes for kids and families.
Oh, thank you very much. That was a great response from both of you. So Mariana says, these analyses are so great. The intersectional approach gives such a richer story than looking at group differences as independent factors. Did you happen to also ask about children's gender? She says, I would be curious whether there was a difference in caregivers' perceptions of children's health based on child gender in combination with race or disability.
Yeah, so I looked at gender, but I don't have the results readily like in mind. So all these actually the analysis was actually controlled for other factors, and it includes provinces. So that like I have data on differences between provinces and their gender, but it's not readily in my mind now.
Thank you. Ananya asks, how are you bringing your results back to communities? And was the historical and socio-political context discussed with respect to disability that intersect with immigration status or how it's contextualized in country of origin? So how are you bringing it back to the community? And then I'll repeat the last part.
Yeah, so in terms of bringing it back to the community, we've had I've made efforts to engage Indigenous communities, share my findings with the Indigenous communities to look at the implications of the studies with them. And we've had one of the issues that came up was around the term ethnicity. and race. So like one of the learnings was to not refer to indigenous populations as like racialized.
Okay.
And so we had to kind of negotiate in terms of like, well, I mean, if this data was all about just the indigenous population, it's like I would have just said, let's use ethnicity for them. But then in terms of also trying to highlight the other racialized populations, like in the study, like Black, Chinese, and other people, we kind of agreed that, well, we are going to use the term like racial identity / ethnicity, and where we specifically make reference to indigenous communities, we would use the word like ethnicity just to respect their values. So
Got it.
These are some of the ways that we kind of included the community, and then we're also working with other like community partners, like local community partners that like focus on racialized children with disabilities, to see how best we could actually include communicate the findings of this research in a way that is meaningful to them, to help them do their work.
Wonderful.
Could I make a quick comment on this? Not to the Lawrence study specifically, but to the complexity in the field. So when we design smaller studies that start with participatory research, and there was a lovely community participatory research discussion before, it is rare that we would combine communities just because they're non-white.
Right.
Into a single study, right? Like we appreciate, like I think most Canadians by now appreciate the richness of diversity that comes from the different communities. When we access national data, it's a slightly different conversation, right? Because it's more about mapping, getting a quick map of the field for the question that is being asked, and the preferred terms and preferred ways of self-identifying for the different communities are not always reflected in that data. And it's not always shared between the different diverse communities, as you would expect by definition when you have diversity. So in fact, this is an area we're struggling a bit, and we would love kind of thoughts and comments as a community, and for us as a community to think about when the work is not about engaging a specific diverse community where research is participatory from the beginning, terms have been defined, people have self-identified the way they like, the data lives as per the rules of that collaboration. When we actually just access national survey data, we probably need to rethink a little bit the framework for reporting on that data and communicating it back to the communities that they contributed. Because remember, when the communities contributed data to those large surveys, they did not know that these types of questions necessarily are going to be asked. This was accessing existing data for secondary analysis. So it does present a problem. For me, it presents one more problem around Indigenous ownership of data. These national surveys do not include necessarily their own reserve data. They're off reserve, and it's one of the limitations of the national surveys. But we typically go beyond the strict regulations when we collect Indigenous data in terms of where ownership is and who gets to interpret it. But this data has not actually, that collection has not always followed those rules.
Right.
So there is some complexity with large secondary data analysis when it comes to understanding race, ethnicity, disability, intersectionality, but maybe there is room for us to all do work and think about.
That makes a lot of sense. And the second part of that question was the historical and social political context discussed in terms of disability status and conceptualization of that within the countries of origin, for example?
Yeah, so this is a secondary data that was collected by like the government of Canada, but with the child and youth functioning model that like they used to that was included in the survey. The attempt is to kind of look at like measure like disability in like in terms of like functioning of like of the child, the functional level of the child from functional level of the child. And then the other attempt is to make sure like to encourage countries all over around the world to use like these specific tools that this specific tool in order to ensure comparative like data analysis across like countries. But in terms of the consultation as to the extent to which like different like people from different countries and different cultural contexts and social cultural contexts were included, what were brought on board to be able to design this specific tool. Like I don't have like any idea about that. Yeah, it's this is a the tool was developed by UNICEF and then the World Bank group.
Thank you very much. And thank you for the end of our session today. I'm just going to sum up a few key takeaways from the rest of the day, but thank you so much for your presentation, and thanks to all of our participants, speakers, and the audience members. It's been an engaging discussion. The chat box is hopping. We will share back to our speakers the comments that they received. They're quite effusive, which is lovely. Again, the theme of the day was intersectionalities. Folks appear to be at greater risk, at least in the two case studies shown when racial identity, disability, and perhaps other social determinants of health are intersected. We learned about some principles of EDI, some practical tips. There are heaps of resources that have been shared that we will include in a summary report of the three-part series, the Child Health Equity Learning Series, that we'll share back out with those of you who've registered. There's a lack of Black and other voices in research and science, and the Embark program was created to break down some of those barriers, and you saw that DeLawrence is one of the benefits of that program, along with the folks that he is serving. The case stories again showed the impact of intersectionality, childhood disability, racial identity or ethnicity, as well as an impact on parents' perceptions of their child's health. And that some of those combination of features and factors put children at greater risk for things like food insecurity and thus poor health outcomes. There were a number of recommendations made throughout the day that we'll capture in our summary, and hopefully we can include those in some of our individual and collective advocacy efforts as we advocate for the importance of an investment in child health research in Canada. Thank you to our speakers today. Thanks to our audience. I want to extend a huge thanks to our sponsors, the IWK, and our strategic partner, One Child, Every Child. And coming up, this might be the end of the day, but it's not the end of the series. Our next session, the last of the three-part series, will take place on March 28th at the same time, 12 to 3. And it's evidence-informed policy, advancing health equity for all children. If you missed any of our previous sessions, check online in the coming weeks. We'll put a copy of our recordings there, and you can wait as well for the summary report that we'll disseminate to you all once the three parts are over. We want to continue these important conversations and the work that we can do all together to ensure all kids in Canada have the equitable access to and experiences of care and equitable health outcomes. So we'd like to gauge interest in participation in a child health equity network. national focused child health equity network. If you're interested, there's a form you can complete. And I think Logan is going to drop the survey link into the chat box. And finally, to help us improve our products and services and events like this one, we'd love to have your feedback in the form of our evaluation. That's also being dropped, the link to which is being dropped in the chat box. And thank you all. We hope to see you again on March 28th. Bye for now.